All right, good morning. Good morning. Welcome to House Labor, Health, and Social Services Committee. Members of the committee, good morning. Members of the public, thank you for joining us. Mr. Caldwell, good morning. If you'd call the roll.
Representative Clouston.
Here.
Representative Guggenmoss.
Here.
Representative Heff.
Here.
Representative McCann.
Excused.
Representative Ottman. Representative Thayer.
Here.
Representative Wasserberger.
Here.
Representative Yen.
Here.
Chairman Rodriguez Williams. Madam Chairman, we have a quorum.
Thank you, Mr. Caldwell. All right. Thank you again for joining us. For those that are in the audience and those online, welcome. Just a friendly reminder when it comes to our meeting general decorum guidelines, please remember committee and those in the audience to silence your cell phones and your computers as well. Committee members, speakers, and audience members, please conduct yourselves in a civil and respectful manner during the meeting and address all comments to the chairman through the chairman. And please refrain from making any comments of personal nature or comments that insult or impugn any other speakers as well. All right, we have a very full agenda this morning, and I am hoping that we can work through it all this morning. If not, we can probably carry over when we adjourn at the end of the day. But this morning we have on the agenda 4 items. We've got first we'll hear Senate Joint Resolution number 6. Then we'll hear Senate File 121. From there, we'll move on to Senate File 106 and then Senate File 122. All right, so the first item or the first bill for the committee's consideration is Senate Joint Resolution number 6, Shared Parenting Day. It's now on the table for the committee's consideration, and it's sponsored by Senator Pearson. Good morning, Senator Pearson. Welcome. If you would do us a favor and walk us through the bill, tell us about the resolution.
Thank you, Madam Chairman, members of the committee. I'm going to make this brief. As you all know, I'm very passionate about shared parenting, so thank you for hearing this. Today, I have the honor of introducing SJ06, which designates April 26th of each year as Shared Parenting Day in the great state of Wyoming. Why April 26th? April 26th marks the anniversary of Kentucky becoming the first state in America to pass a strong shared parenting law. Since then, Missouri, Arizona, Massachusetts, Maryland, and South Dakota have joined in officially recognizing this day. With SJ006, Wyoming proudly steps forward to stand with them. Our children are Wyoming's most precious resource. They thrive when they know deep in their hearts that both mom and dad are still fully their parents even after separation. This resolution is more than symbolism. It sends a powerful message. Wyoming values strong, loving relationships between children and both of their parents. It honors the moms and dads who show up every day. It reminds us that cooperative parenting builds healthier kids, stronger families, and more resilient communities. By passing SJ6, we celebrate the irreplaceable role of both parents in raising Wyoming's next generation. Every April 26th, let this day remind us why we're here, to protect and strengthen our families. I ask you to join me in passing SJ6 so we can proudly recognize Shared Parenting Day and continue building a Wyoming where children come first. And in the honor of time, do you want me to read through the resolution for you?
I think that pretty much sums it up. If you'd stand for any questions from the committee, we'd appreciate it.
Yes, ma'am.
Committee, any questions about the resolution? It's pretty short and sweet. Representative Yen.
Madam Chairman, thank you, Senator. I'm curious, usually we put holidays in statute and not as a joint resolution, especially if it's one that we will continue to highlight every year. I'm curious, the choice between a joint resolution versus putting it in our holidays statute.
Senator Pearson.
I was just I'm just trying to make a statement in Wyoming. I wasn't sure, given that this is a budget session, whether this resolution was actually even appropriate, but I was also trying to run a shared parenting bill. And then trying to run this resolution along with it. The bill failed introduction by 2 votes. But I'm going to keep pushing on that. So that was the reason this resolution was just kind of to go in coordination with the bill that I was trying to introduce. So I don't know if that answers your question. I'm new to all of this. I don't know what is the proper way to do things, but this is the way that I thought that I would do it. So thank you.
Committee, any additional questions about the resolution? Okay, seeing none. Thank you.
Thank you.
Yep. Are there any government agencies that like to come forward on Senate Joint Resolution number 6? Okay, seeing none, we'll open it up for public comment. Any public comment? Good morning and welcome.
Morning,
Please state
Madam.
your name and we'll hear your take on the bill.
Morning, Madam Chair, members of the Labor Committee, Jeff Daugherty, appearing as an individual today. Just in the interest of time, I will be very brief. I'm appreciative of the senator and her work in this area as a coach, as a 4-H leader, I do a lot of volunteer work with kiddos, and I'm blessed to have not ever had to go through a horrible divorce, but I see so many kids that do, and they need both parents. And I love that she is trying to establish recognition for the fact that there needs to be judicial reform going forward so that courts understand better that it's vital that both parents be involved. Madam Chair, I'd stand for questions.
Thank you. Committee, any questions of Mr. Daugherty?
Thank you.
Okay, see none. Thank you, sir. Here's, we have somebody online. Okay, you'd let them in.
Hello?
Hello, good morning. We can hear you. If you'd state your name and we'll hear your take on whether or not you support the bill or oppose it.
I do support it. My name is Lincoln Winter. I've served for 22 years as a pastor in Wheatland, Wyoming. I've also served during that time for 6 years in Pine Bluffs as a pastor. And I've seen the damage that happens to children and to fathers and mothers with divorce and custody battles. And I'm a firm believer that children need both parents whenever possible. Various studies have shown the suicide rate for divorced fathers is between about 250 and 900% higher than for married men. I've seen this happen, and it is a terrible thing, not only for the children, but for extended family. And I believe the state has a significant interest in passing laws to encourage what's best for children. Article 7 says that because of that, we offer a free education. And Section 20 of that says that laws should be passed to encourage what is best for children and what helps them. And I think that this bill does that. It doesn't cost anything, but it encourages something that I would hope everyone can agree is a public good, that children need fathers and mothers in their life. And every study in the last 50 years says that that is true. Incarceration rates are lower among children with fathers and mothers, divorce rates later in life, suicide, drug addiction, all of those problems are improved with the presence of a father and a mother. And that Obviously, there are situations where that can't happen, but whenever possible, I think that we should encourage and consider that. And I thank you for taking the time to consider this bill. Thank you.
Thank you. Committee, any questions of Pastor Winter? Okay, seeing none. Thank you, sir, for joining us this morning.
Thank you.
Okay. Good morning and welcome. If you'd state your name and we'll hear your take on the bill.
Thank you, Chairman. My name is Jonathan Lang. I'm a pastor in Evanston and in Kemmer, and I want to thank the bringer of the bill. I have partly instigated it and encouraged her to bring it because I believe it's a very important bill. I don't want to repeat what previous testimony has said, but because I'm interested in the rest of your agenda too. But I just want to speak to the aspect of setting aside a day. This is more than a gesture in my mind. When we set aside one day, it allows kind of people to concentrate thought rather than just kind of a conversation here and a conversation there. It allows us to come together and to set our minds to the problem, and then that will lead to, I think, better solutions. And I'm always struck by Psalm 41, verse 1, blessed is he who considers the poor. And oftentimes problems in our society might kind of go under the radar, and setting aside April 26th is a time for all of us to think about it together, and at the same time, I think can raise a lot of collaborative energy. And so that's why I support the Shared Parenting Day. And but I don't want to take up any more of your time. I stand for questions.
Thank you. Committee, any questions of Pastor Lang? Okay, seeing none. Thank you, sir, for joining us.
Thank you.
Any further comment online? No? Okay. With that in mind, I will close public comment on Senate Joint Resolution 6. Committee, what is your pleasure? Bill's been moved by Representative McCann, second by Representative Thayer. Any discussion or amendments on it? Okay, seeing none and the question being called, Mr. Caldwell, if you call the roll on Senate Joint Resolution number 6.
This is a roll call vote for Senate Joint Resolution 6. Representative Clouston.
Aye.
Representative Gugemas.
Aye.
Representative Heff.
Aye.
Representative McCann.
Aye.
Representative Ottman.
Aye.
Representative Thayer.
Aye.
Representative Wasserberger.
Aye.
Representative Yen.
Aye.
Chairman Rodriguez Williams. Madam Chairman, that is 9 ayes.
Okay, committee, Senate Joint Resolution number 6 has passed committee. Senator Pearson, if you'd pick a co-sponsor to carry the bill on the floor, that'd be great. Thank you. We will move on to the next bill, which is Senate File 121, Wyoming Pharmacy Act Amendments. This bill is sponsored by Senator Dockstader, who I do not see. He was here earlier. Okay. Oh,
There he is.
there he is. He's walking in. Good morning, Senator. Welcome. Senate File 121 is now on the table for the committee's consideration. Good morning, sir. If you would walk us through your bill.
Good morning, Madam Chair. Good morning, members of the committee. I bring you Wyoming Pharmacy Act amendments. This started last summer when a group of us came together with those who are taking care of our pharmacies across the state. We met in Casper and actually put this piece of legislation together. But I'd note, Madam Chair, and for the members of the committee, that we took it further. Once we started it in another part of the building, we saw that it needed further changes. So we brought everybody that was involved, those dealing with medical health care, those from the pharmacy, everyone put them in a room around the table, and this is the final product that you have in front of you today. An agreed upon piece of legislation that everyone in this world of healthcare is comfortable with. Madam Chair, members of the committee, essentially amends the provisions of the act, takes care of the what a pharmacy means, the patient counseling, and it provides the rules as you go through there. Much of it was taken out based on that second meeting that I just told you about, and confined the collaborative agreement goes on to 3 and 4, where that's where the agreement talks about how they're going to come together. And maybe the key part that a lot of people were interested in, we moved the immunizations at the pharmacy level, where pharmacies are already doing immunizations. We moved it from 7 to 3, but it's only for those who want it, and it's for the pharmacist who agrees to do it. Nobody's forced to do anything in this scenario. It just opens up a broader range of healthcare. Let me summarize essentially what it does. Apologize, it was coming from across the hall in another committee. These are the key points of what this does, Madam Chair and members of the committee. It improves healthcare across rural Wyoming. Many communities face provider shortages and long distance of travel. This allows pharmacists to prescribe certain medications and devices such as glucose monitors and antibiotics, positive strep tests and so forth. It kind of fills a healthcare gap and allows it more timely manner closer to home. That's the first thing. Madam Chair, members of the committee, second, it supports the state's healthcare expansion goals. The legislation empowers the Board of Pharmacy to create clear, responsible rules to expand pharmacy services, directly fulfilling Wyoming's grand objective to improve healthcare access, particularly in the rural communities. That's second. 3, it allows for the immunization coverage for those who want it, those who request it, and the pharmacist who agrees to do it. No one is forced to do this. And 4th, it enhances chronic disease management and preventative care. Pharmacists are highly accessible healthcare professionals. Expanding and prescribing authority for specific medications and devices improves diabetic management, preventive care, early treatment, reducing complications and overall healthcare costs. And it's still based on the pharmacist's judgment. We left all those protections in place. With that, Madam Chair, members of the committee, I bring you Wyoming Pharmacy Act amendments, Senate File 121. Thank you.
Thank you, Senator. Committee, any questions regarding the bill? Vice Chairman Otten.
Thank you, Madam Chairman and Senator. I have a question on the vaccination portion. While I know that pharmacists are a great advantage when between doctors and patients and things like that, and watching medications, and this is really good. The one thing that I wonder about is the vaccines to the children, because it doesn't seem like there's you don't have to have a doctor, or you're not under doctor's care really to get the vaccinations. Maybe you can expand on what your committee talked about.
Thank you,
Senator.
Madam Chair, Representative Ottman. Talked about this, and this was, if I can allow for some further discussion too later. For those in the medical healthcare world, everyone was comfortable with the level that we were offering at. We weren't imposing anything. We weren't taking, Madam Chair, Representative, we weren't taking anything away from a physician's care. Simply the basic immunizations. These are already provided. This just simply expands it to age 3. The whole family goes in. In some instances, we had situations where entire family would come in to take care of their immunizations at a pharmacy close to their home without waiting to go through an appointment with the doctor. Pharmacy can improve it working with the physician's healthcare. But we found that part of the family was left out because it wasn't all encompassing for the age group. Thank you, Madam Chair.
Thank you. Committee, any additional questions of the bill sponsor? Okay, seeing none. Thank you. Are there any government agencies that like to come forward? SF 121. Good morning. If you'd state your name and we'll hear your take on the bill.
Good morning, Madam Chairman. My name is Matt Martin. I'm the, excuse me, I'm the Executive Director for the Wyoming State Board of Pharmacy. So I was just here to answer any questions that the committee may have on the bill.
Thank you. And can you repeat your name again?
My name is Matt Martineau.
Thank you. Committee, any questions from the Board of Pharmacy? Representative Heft.
Thank you, Madam Chairwoman. Thank you for coming, sir. I have a concern with immunizations that may have a negative reaction. How would a pharmacist handle that? So he vaccinates a child at the age of 3 and he has a negative, like say an immediate reaction to it. How would that be handled?
Madam Chairman, Representative Heft, part of the training that pharmacists have to undergo and complete is to be able to respond in the event of an emergency like anaphylaxis or anything like that. So they have to have epinephrine on hand. They have to be able to be trained to do CPR. They have to be staffed to be able to contact emergency services and be able to provide care until they arrive. In the event that an adverse reaction happens, the pharmacist also has reporting requirements that they have to report that into FDA's adverse events website to track that information to see if there's something to see if there's some sort of problem with the vaccine as a whole, that maybe there's an entire class of people that may be affected by something with it, with a component, or maybe there's something specific to that lot number that may result in a recall needing to be made or something like that. So yes, pharmacists are trained to be able to respond, and they have reporting requirements in the event that an adverse event happens.
Additional questions, committee? Representative Yen.
Madam Chairman, thank you. Mr. Martineau, appreciate you being here as always. How long have we had the immunization portion in the Pharmacy Act?
Director.
Madam Chairman, Representative Yen, the immunization portion goes back to, I want to say probably 2011, and that's when it began first as pharmacists could administer the flu shot. From there, it increased in scope to being able to do flu shots to people as young, or pardon me, to children as young as 7. Then it increased to being able to do shots for adults, and it included a specific list of them. And then that grew to include those minors as well. During COVID, when access issues became a very big concern, that's when the PrEP Act by the federal government kind of stepped in and tried to address some of these access needs and said that pharmacists can administer vaccines to children as young as 3 to help make sure that care isn't being interrupted while that was happening. The provisions of the PrEP Act have been extended, at least as far as the flu and the COVID vaccine go. So pharmacists under that act are still able to administer to children as young as 3. Again, there's nothing compulsory to it. It's to parents and children who want to have it and pharmacists who are willing to administer it.
Thank you. Representative Clauston.
Thank you, Madam Chair. Thank you for being here this morning. Just a quick question on what's the coordination and communication like between the pharmacist and the physician, the pediatrician? So how does the pediatrician know that these vaccinations are up to date?
Director.
Madam Chairman, Representative Clauston, pharmacists have a reporting, in addition to adverse reporting requirements, they also have reporting requirements into the Wyoming Immunization Registry. So every vaccine that a pharmacist administers has to be reported into that. And so from there, providers can go in and see the record and make sure that the individual's vaccine is up to date. And that's actually a tool too that pharmacists have access to and can utilize to say, well, I see that maybe you do or don't need this shot because you last had it on such and such a date or whatever.
Additional questions, committee? Representative off.
Thank you, Madam Chairman. It's good to see you here today. Thank you. with children 7 years old, and this is just a generic question because it's kind of one of my concerns. They can say, act like they feel well, or they can say, something itches or something hurts or whatever. With a child as young as 3, I'm wondering about any kind of reaction. Also, who determines, like if a child goes in and the parent says, I haven't kept them up on their vaccines, so what should we do? And they say, well, let's just give them a protocol. Let's give them all of them. Or how is that determined? Who determines it? And is there a doctor at all, or is it due to the training for the pharmacist?
Director.
Madam Chairman, Representative Ottman, that falls into the training and part of the counseling that the pharmacist would be doing. They would be doing that assessment with the parent or guardian to find out, okay, why are you here? Do you want this vaccine? Let's take a look. Is there anything that's outstanding? They'd present all those options to the parent or guardian and let the parent or guardian choose what it is that they want to do. Some of it may be dictated by insurance, because if they want to have, for the sake of argument, 3 or 4 vaccines, but only the flu shot is covered, then maybe they don't do the other 2 or 3. They only do the one that's covered, and then the pharmacist instructs them to follow up with their primary care provider for the others.
Thank you. Committee, any additional questions? I have one for you. Can you tell me whether or not the state has a repository for reports of adverse reactions or vaccine injury? And is it available to the public?
Madam Chairman, I do not know if the state has one. I know that FDA has its adverse drug reporting, and you can go in there and see everything that's reported to the feds there. But as far as the state goes, I'm not sure on that.
Thank you. Committee, any additional questions? Representative Thayer.
Thank you, Chairman. This sounds like a benefit in our healthcare deserts for our rural communities. Just a clarification, and thank you for being here. Again, on the immunizations, it's just a change in date or change in age. They're already doing it. And then again, the final decision for which shots are given or immunizations are given are the parents and not the pharmacist. Thank you.
Director.
Chairman and Representative Thayer, yes, that's correct. The pharmacist isn't going to tell the patient, you have to have these vaccines or else. I mean, it's purely voluntary. Most pharmacies will try to have some mechanism where the patient can interact with either an online portal or something to where they can set up an appointment just to try to ease the visit a little bit. But walk-ins are welcome in every pharmacy, and like I say, it's completely voluntary.
Representative Gugamas.
Thank you, Madam Chair. Let's say you have somebody come in who is not current on their, like a parent bringing in their child to get some immunizations, and they are behind. And there's going to be, say, 4 or more in order to get them caught up. What would the pharmacist do? Would they just, if that's what the parent wanted, would they just do that? Would there be any kind of caution talked about as far as the number of immunizations at one time, or how does that work?
The director.
Chairman Rodriguez-Williams, Representative Guggenmoss, that's part of the element of counseling. If the parent wants to get their child caught up, the pharmacist can do that. Best practice would be to make sure that they're tracking where they're putting each vaccine. You're looking for the muscle mass, usually the deltoid here in the shoulder. But with a little kiddo and having to do 4, you're probably looking at 2 and 2. So you'd want to make sure that you recorded, I did the flu shot on the right in the front, and I did the Tdap on the right in the back, or something like that, so that in the event of a reaction that's maybe delayed, that doesn't happen within about 15 minutes, you can try to say, well, it was probably this one or that one. or it was definitely one of these two. Part of that too is to provide good care and bedside service, I guess you could say, because you don't want to have a little kid who's gotten walloped with 4 vaccines in one arm. That'd be really painful.
Follow-up, Representative Guggemos.
Thank you, Madam Chair. So there really is no concern about just overwhelming the body as a whole with multiple immunizations at one time.
Director.
Chairman Rodriguez-Williams, Representative Guggenmoss, as long as there's no absolute or relative contraindication, like that the patient is immunocompromised or that there's some sort of risk, there's, to my knowledge, there's not any additional risk by providing 1 or 2 or 4 vaccines to an individual, whatever their age.
Any additional questions? Okay, seeing none. Thank you, sir, for joining us. Any additional government agencies on the bill? Seeing none, we'll open it up for public comment. If you'd like to testify, please come forward. Good morning. If you'd state your name, we'll hear your take on the bill.
Good morning, Madam Chair, members of the committee. Thank you for having me here today. My name is Melinda Carroll. I am representing the Wyoming Pharmacy Association, and I am a practicing pharmacist of 13 years. I strongly support this bill as well as our membership. With this, I would like to refocus on what this is actually doing, which is opening access to care in our communities. With this, we have had strong support because it is much easier for people to get in to see a pharmacist. Your first touch point in the healthcare community usually is a pharmacist. You're most accessible. The person that you would go ask the first piece of advice is oftentimes a pharmacist. And this is opening what the practice of pharmacy actually is. This has not been updated since 1957. Since 1957, the practice of pharmacy has evolved tremendously. It has gone from a bachelor's degree to a doctorate degree. We have a doctorate in pharmacy. With that, our ability to do things like assess the patient, determine what is going on, assess them for any adverse reactions, or assess them for any healthcare issues. We specialize, obviously, in the medicine part of it and what that does to a person. So with this, pharmacists have broader ability to help your communities, help the patients that live there, because we do have a true provider shortage in the state, and that is just the fact. Pharmacists are far more accessible and can do things like test and treat. So we can test a patient to see if they have the flu. We can test a patient to see if they have strep. We can test a patient to see if they have COVID and let them know that those are all things. This helps us help the patient gain access to medications that they may want if they do test positive for those things. It also allows pharmacists to do something that we are trained to do, which is administer medications, because we have to counsel patients on administering medications. However, in the current practice of pharmacy, it is not a stated ability of a pharmacist. And so you have pharmacists in the ICU or in the emergency department that draw up medications such as epinephrine, which is needed in a code to help save a life. However, they cannot administer that medication. They have to hand it off to a nurse to administer, which decreases safety, decreases response time. There's several issues with that. This would include that practice of administering medications for pharmacists. Onto the immunization portion. I know that it gives a lot of you pause, and I understand that. I know that we all have our strongly held beliefs on immunizations, and I think that that is a good thing. I think that people should be well informed and should know what they are putting in their body when they do that. With that being said, I'm a practicing pharmacist. I had a 4-year-old in my pharmacy this weekend that we administered a flu vaccine to. Would I recommend a parent give a child 4 immunizations at once in the pharmacy? I would caution pause because I do that for adults as well. I think that if you are getting multiple immunizations, your risk of feeling probably not so great in the following days, or it's much higher. And so, yes, those are real things that I consider when I am talking to parents. However, I always take into consideration what the parents' feelings are in regards to immunizations. This is not anything that I would force on anyone. It is something that I have long discussions with patients when I counsel them on what I think is going to be appropriate. Other than that, it's just really giving the patients that choice and that ability to access healthcare in a way that they feel is right and they feel is convenient for them. With that, I would stand for questions.
Thank you, Ms. Carroll. I have one for you. If this bill were to pass, is there any discussion about potential increase in medical malpractice insurance for pharmacists?
Thank you, Madam Chair. Most pharmacists already carry malpractice insurance. We have our own malpractice insurance. I personally carry a plan. With that, usually the employer that you work for also carries malpractice insurance. And so I would encourage members to seek malpractice insurance on their own. However, it is not mandated in this. So it is a situation where that would be determined if it was a need or not. Again, in the Act, there are protections for pharmacists where they don't have to engage in these activities if they do not feel comfortable or if they do not feel trained to do so.
Thank you. Committee, any questions of Ms. Carroll? Representative Clouston.
Thank you, Madam Chair. Thank you, Ms. Carroll, for being here. So haven't seen you much lately, so. When a pharmacist administers the vaccination, is it a procedure code per vaccination? Is it a procedure code charge per visit? Is the charge only for the vaccination?
Ms. Carroll.
Madam Chair, Representative Clouston, thank you for that. With that, there is a administration fee that goes along with immunizations, and that's how it is coded as an administration fee. This is paid through not the medical insurance side, but the pharmacy benefit side, which Director Martineau had spoken to earlier. It's billed differently than medical services.
Follow-up, Representative Clouston.
Thank you, Madam Chair. So I guess the question being, if I need 3 vaccinations, am I getting a procedure fee code for each vaccination? Or is it just kind of a same fee if I get 1 or 3?
Ms. Carroll.
Madam Chair, Representative Clouston, that fee is determined unfortunately by the pharmacy benefit manager. So it is paid based on what they pay. You potentially, that is built into the billing there. And so with the administration fee, it is generally per vaccine. However, it would be determined ultimately by the pharmacy benefit manager and not the pharmacists themselves. So there is no benefit for us to encourage more immunizations so that we can get a greater amount.
Committee, any additional questions? Okay, seeing none, thank you, ma'am, for joining us.
Thank you.
Any additional public comment? Is there anybody online? Okay. Good morning. If you'd state your name and we'll hear your take on Senate File 121.
All right. Thank you, Chairman Rodriguez Williams, members of the committee. My name is Camilla Hancock. I am a pharmacist in Basin, and I'm also the president of the Wyoming Pharmacy Association. I'd like to thank you for the opportunity to address you on the importance of this bill to our rural communities. The town of Basin has a population of 1,300, with roughly 23% of those being senior citizens, many of whom do not drive. In terms of healthcare, Basin has Basin Pharmacy, where I work, which is located on Main Street, an outreach clinic, which sends specialists from Cody once a month, and the small county hospital with its small clinic, which is located between Basin and Grable. We do not have any urgent care, and there is no other healthcare resource in the small surrounding communities of Manderson, Hyattville, Tensleep, Otto, and Burlington, all of which are local pharmacy services. I work at Basin Pharmacy on Fridays and Saturdays and the hospital on Mondays. This gives me a unique opportunity to view our local healthcare system from different perspectives. I have been working on a Friday afternoon and had a senior citizen drive to the pharmacy in their electric wheelchair to look for help with a urinary tract infection. By this time of day, the clinic's closed for the weekend, and the senior citizen van is no longer providing rides anywhere until Monday. The patient has come to the only place that they can for healthcare, which is the pharmacy, and I help them as much as the law allows me to. The next Monday, I arrive at work and review the patients who have been admitted and the medications being used to treat them. Imagine then how disheartening it is to see the sweet lady that I had helped on Friday admitted via EMS on Sunday night when the UTI had gone septic. I had been with her, had tried to help her, and was unable to not because I lacked the training, but because I was not allowed to by the constraints of the law. I want you to think of the strains this situation placed on this patient. Not only did she experience unneeded pain and suffering, but she was paying for EMS, which was needed to transport her due to lack of transportation, expenses incurred from the emergency room visit, and a 3 to 10 day admission to the hospital. Now think of the strain this placed on our local healthcare system. Our local hospital only has 2 emergency room beds and 5 inpatient beds. It doesn't take too much to have those fill up, especially since it provides care for around 1,600 square miles of people. I mentioned our hospital also has a small clinic. It has 2 PAs who work 4 days a week and 1 doctor who comes from Cody once a week. One of our PAs is going to retire in the next year or 2. Trying to get in and see a provider is going to become much harder when that happens. If pharmacists were allowed to be a better team player, we could help with this. We wouldn't have patients making appointments for their B12 shots or other medications to be administered at the clinic. Pharmacists could administer them, thus opening a spot for the provider to see someone about a more complicated issue. We could vaccinate the whole family on the weekend when parents were off, so multiple appointments weren't needed. We could potentially, after rules were created by the Board of Pharmacy, test and treat, thus keeping patients from going septic over the weekend when no clinic was open. This bill greatly increases access to healthcare, especially in our small rural communities. This bill will provide much needed relief to my community, and I'm sure to many other communities. I urge the committee to pass this bill so pharmacists can help transform our rural healthcare from healthcare deserts to places we can all flourish. And with that, I stand for questions.
Thank you. Committee, any questions of Ms. Hancock? Representative Clouston.
Thank you, Madam Chair. Thank you for being with us. So with this updated Practice Act, in your example with your patient that went septic, how would this new bill allow you to do things that current statute does not?
Granted, with the way this bill is, it would, excuse me. Thank you, Madam Chair and Representative. The bill will allow the Board of Pharmacy to create rules that would allow pharmacists to perform a urinary tract infection test and then be able to prescribe antibiotics to help that patient with that. And that in turn would help keep patients from going septic. Just as an example, this was a real scenario. And just last week, my hospital technician and I were discussing the fact that we have seen a large increase in urinary tract infections in our senior population that has led to hospitalization in our community. So it would definitely be helpful.
Committee, any additional questions? Okay, seeing none, thank you, ma'am, for joining us.
Thank you.
Mr. Caldwell, is there anybody else online? Okay. Last call for public comment on Senate File 121. Okay. I will close public comment. Committee, what is your pleasure?
Move the bill.
Bill's been moved by Representative Clouston, second by Representative Thayer. Discussion amendments. Representative McCann.
Thank you, Madam Chair. The only thing about this bill that gives me pause is the immunizations part. I think we should actually be scrutinizing immunizations more as opposed to making it easier to get them. That for me, if that wasn't in here, I would be happy to say aye, but that's a showstopper for me. These immunizations are not what they used to be. The old attenuated viruses, maybe, but this new stuff, the mRNA, there's just too many questions about that kind of medicine. And with that, I'll be a no.
Committee, additional discussion or amendments? Representative Gugelmas.
Thank you, Madam Chair. I'd second that. That pause on the immunizations, especially after we just sat through one committee meeting and saw a poor girl that had a very adverse reaction and how it negatively affected her life in a massive way. So I think pause should be taken. And with no adverse reporting or anything like that, it's kind of like shooting in the dark. And I not very comfortable with that. Thank you.
Additional comments, questions, or amendments? Representative Clouston.
You know, I think this solves a lot of problems in Wyoming and helps in a lot of other ways. I really appreciate your concerns with the immunizations. They had been able to do it up to age 7. Just for the rest of the committee, is there an age that you guys would feel more comfortable with? I mean, age 5, age 6. I mean, they can already do it now if it's age 7 or older. This bill changes it to age 3. So are there some thoughts there? Instead of killing the whole bill, is there thought, or you want to leave it at age 7? You think age 5, age 6? So, I mean, I think this bill does a great service for Wyoming. It updates the Practice Act, which is needed. I think if that's the case, maybe we discuss that here or discuss on the floor instead of killing the whole bill.
Additional discussion or amendments? Representative Wasserberger.
Thank you. Thank you, Madam Chair. I mean, 5 would probably be better than 3. I can just tell you a personal story of mine. When my niece was 5, she got vaccinated, and the only one out of 5 children, well, her and then the one older son. The older son didn't have any adverse reactions. My niece, however, had several adverse reactions to it. And there was countless times where we were wondering if she was going to survive or not. We finally found some naturopathy that has reversed that. But I mean, we spent probably 6 years trying to do everything we could and questioning if we were going to be able to keep her alive or not. So even at 5, I'm still a little bit nervous with this amendment. So I'm probably going to be a no.
Committee, additional discussion or amendments? Representative Yin.
Madam Chairman, so looking through our K to 12 immunization schedule, we require diphtheria, Hep B, measles, polio, chicken pox. So I guess the question is, do you just feel unsafe that pharmacists are doing it because they still have to get these immunizations? Pharmacists being available to do it just means more access under someone who has a doctorate and training. So I guess I'm curious on the pushback at all, because again, we are still requiring these immunizations for kids.
Representative McCann.
Thank you, Madam Chair. The fact that we have Hep B on day one of a child's life, it proves my point. That is only contracted through sex or IV drug use. So the fact that we have this on day one for an infant and in elementary school proves my point that this immunization thing has gotten to be a little bit ridiculous in my mind. I would be amenable to us keeping it at 7, but I don't want to go any lower.
Additional discussion, Representative Yen.
And Madam Chairman, then I move to delete the page that has immunizations on it, which is page 3, starting at lines 22 to 23, up into page 4, line 20. Just remove it from the bill.
Okay, we have a motion to move it to age 7, you said?
Madam Chairman, by removing the language from the bill, it keeps it at age 7, which is where it is currently.
On page 4, line 4.
Correct.
Is there a second?
I'll second.
Second by Representative Ottman. Mr. Caldwell, you have that? Okay, discussion on the amendment. Vice Chair Ottman.
Thank you, Madam Chairman. And just to say, the pushback on that and the muster, I don't recall what year the schedules of vaccines has gone up, but it has increased substantially over the last 15 years. So in response to the representative over here that has a concern, I don't want to think that that is to be dismissed, and that's why I second it. It's something that really needs to be looked into because we have evidence that there could be problems with individuals. You know, we're all different. We all have different things, but to keep the bill moving forward, I would support taking out, lowering the age and continuing on with the bill.
Okay, any additional discussion on the amendment? On the amendment. Okay, seeing none, sensing the urge to vote by a voice vote and a show of hands. All those in favor of Representative Yen's amendment, please state aye.
Aye.
All opposed? Okay, that amendment has passed. Further amendments, committee on the bill. Further discussion on the bill. Okay, seeing none, question being called. Mr. Caldwell, if you call the roll on Senate File 121.
This is a roll call vote for Senate File 121 as amended. Representative Klauston.
Aye.
Representative Guggenmoss.
Aye.
Representative Heft. Representative McCann.
Aye.
Representative Ottman.
Aye.
Representative Thayer.
Aye.
Representative Wasserberger.
Aye.
Representative Yen.
Aye.
Chairman Rodriguez Williams. Madam Chairman, that is 9 ayes.
Okay, Senate File 121 has passed committee. Senator Dockstetter, if you have a co-sponsor on the House side to carry the bill, that would be great. Thank you for joining us. We'll move on to the next bill that's up for consideration and is now on the table, Senate File 106, Welfare Fraud Prevention Act Amendments. This bill is sponsored by Senator Beitman. Good morning, welcome.
Good morning, Madam Chairman, members of the committee. I bring you Senate File 106, Welfare Fraud Prevention Act Amendments. As you know, Wyoming already has a pretty substantial welfare fraud act that's been in statute for a while now. This bill just goes in and ensures that Wyoming's compliant with the new federal law that was part of the One Big Beautiful Bill Act, and kind of gets us lined up with that. It just strengthens our fraud prevention, fraud prevention strategies. At the core, this legislation does three things. We verify eligibility, we ban illegal immigrants from receiving welfare, and we improve transparency. That's what the bill does. I'll be happy to walk you through the bill, but just kind of the big picture stuff, because I know there'll be more expert testimony coming in behind me. The idea is basically if you don't qualify to be on welfare in Wyoming, you shouldn't. And we should be doing everything we can to check that, to verify that A, you are who you say you are, B, you're in this country legally, all the common sense things. These are like 90-10 issues that everybody can agree on. And this simply just updates our Welfare Fraud Prevention Act. One of the highlights of this bill, it does require verification through the SAVE Act, or the SAVE system. I don't know if you're familiar with that, but it's, in my dealings with the White House over the course of the past year, talking with senior White House officials, they're really proud of that SAVE system and how easy it is for people to run somebody through that system quickly, determine eligibility for multiple different public benefits. This would put that it would codify that in Wyoming law. So I think it's just a one-stop shop that we can have our agencies run through that system. They may or may not already be doing that, but this codifies that. And as we went through the bill in the Senate, Madam Chairman, we had some, this bill did come late, which is why I don't have any co-sponsors. I had to hurry up and file it, draft it on the last day or two before the deadline. Because I wasn't planning on bringing any bills this year, but in the Senate, we could only bring 3 bills and everybody was full and I couldn't find anybody. So that's why I volunteered to do it. I did get an email off to Departments of Health and Family Services, asked them to take a look at the bill, give me back some feedback. They did. We amended those amendments into the bill, so that's why you see an engrossed copy. I didn't have time to get the hospital association's concerns addressed because those came on the day of third reading. And I promised the hospital association that before it came to your committee, that we would work with them and address their concerns and make sure that this bill is up to snuff in their eyes as well. So there will be a committee amendment that I have emailed you on the work of that compromise. Don't know if you've seen it yet, but I also emailed your staff as well. If that's something you want to look at, feel free to do that. That would be on page 14, where we're talking about collection of data. There's some privacy concerns that the hospital association raised that I think were valid. So hat tip to them for bringing that to my attention. But as you can see, most of this bill is conforming language. It's just making adjustments through the page by page. We're just adding different things to the current law that is already in existence. If you do go to page 14, I can kind of walk you through the conceptual amendment from the Hospital Association. It's just pushing things out to April 1st of 2027 mostly. Gives them time. I'll let them explain it to you and other folks that want to testify on the bill. But I think it's a good bill. I think it's common sense. Happy to stand for any questions on anything specific in the bill, but it pretty much speaks for itself. So, Madam Chairman, with that, I know you guys are busy. I will stand for questions. If there's no questions, then I'm sure some folks behind me would like to get their 2 cents in on the bill. So,
thank you. Committee, any questions on the bill of President Beitman? Representative Clouston.
Thank you, Madam Chair. Thank you, President Beitman.
Morning.
On page 13, I'm looking the second paragraph there. I guess the one thing that gives me a little bit pause. It says when applicant status cannot be verified through available data sources, the department shall provide only a single reasonable opportunity period. So I guess my question there is, you know, if someone doesn't have all the information, doesn't know what they need to bring, I guess a one and out is my concern there. And maybe somebody else in one of the departments can speak to that, how that currently works. What are the accommodations if someone needs a second chance?
Madam Chairman, I can't tell from my engrossed copy if that's existing language or not. I might have to punt on that, Representative, and if you don't get an answer, I'll come back at the end and get you that answer. But I can't tell from my engrossed copy if that's existing or if that's something new with the bill, so I'll double check.
Committee, further questions of the bill sponsor? Representative Yen.
Madam Chairman, thank you, President Biteman. There's a lot of reporting requirements in here. I'm curious, and I'll probably ask this of the department, what is our current Medicaid fraud rate? And do you see this bill causing that to go down, or where do you, what improvements in Medicaid do you see coming from this bill?
Madam Chairman, Representative, our fraud rate's pretty low. It's really low. Wyoming, this is not an indictment on Wyoming's welfare fraud prevention efforts. This is more just getting things in line with the one big beautiful bill and making sure that we're codifying things that need to be codified at the state level. A lot of states don't have even what we have with this Welfare Fraud Prevention Act that's been in statute for a while. Wyoming's been ahead of the game for many years, and there's not a lot that we need to do. A lot of these are reporting requirements and adjusting the time frame of, you know, should it be a year? Should it be every month? Should it be every quarter? Those are policy questions that we need to answer, but most of the reporting requirements, you know, I think the agencies can do. But no, to your question, our fraud rate's pretty low. Yeah.
Additional questions, committee? Okay, I have one on page 16.
Okay.
Lines 1 through 10 in regards to reporting requirements. It mentions our joint interim committee at the bottom of page 15, carrying on to page 16. And line 4, the report shall also describe information relating to the costs of uncompensated care for aliens who are not lawfully present in the United States, the impact of uncompensated care on the cost of ability of hospitals to provide services to the public, hospital funding needs, and other related information. How will this be collected and who will it go to?
Madam Chairman, I think it's in the bill, how they've got to, with this data that they're going to be collecting, they'll be able to find out, you know, they can't not treat illegal aliens, obviously, at the emergency room and things like that. But with this amendment to the Welfare Fraud Act would require that reporting to at least be collected, so we know how many, number one, and how much does that cost the state. It's just so for our own purposes, how we know that, and that it's up to you. Probably you'll have to ask the departments how they're going to collect that data, and I think that's probably part of what the Hospital Association had a problem with the original language of the bill on the privacy concerns, like at the emergency room type of situation, because you can't keep people from getting care, and you don't want to make it too onerous to have them fill out a bunch of things while they're bleeding out, obviously, right? So but that information will get collected, and you will get that report every year as a committee, so you'll have that data and you can make policy decisions based on that data.
Thank you. Additional questions? The bill sponsor. Seeing none, thank you.
Thank you.
Are you sticking around?
If you want me to.
Please.
Okay.
Yeah. Any government agencies that would like to testify? Good morning. If you'd state your name and we'll hear your thoughts on the bill.
Good morning, Madam Chairwoman, members of the committee. My name is Corin Schmidt, and I'm the Director of the Wyoming Department of Family Services. And in regard to the bill, as you're seeing it, we are fine with it. We can comply readily with everything. I'm really just here to answer any questions you may have.
Thank you. Committee, any questions of Department of Family Services? Representative Clouston.
Thank you, Madam Chair. Thank you, Director. Does this add any increased responsibilities? How does this change what you're currently doing?
Director.
Madam Chairwoman, Representative Clouston, it adds a few more checks on citizenship. Currently, we check citizenship on a particular set of individuals who apply for SNAP. This will require us that on any applicant that we will check citizenship. It's automatic, it's an electronic check, so it'll be no problem to implement that for all of our certification and recertification periods.
Additional questions, committee? We're a lively bunch. Thank you. Please state your name and we'll hear your take on the bill.
Chairman Rodriguez Williams, Jesse Springer, State Medicaid Agent, joined by Franz Fuchs, Deputy Director of the Department of Health. I'll just stand for questions. We generally have very little with the current form of the bill. We're already compliant with everything in the bill because it's required by the Big Beautiful Bill Act. So we have either done those things before that bill had passed prior to summer 2025, or we have already implemented them. So.
Okay. Committee, any questions of the department? Okay. You'd like to add something?
Chairman, there was a question about the single reasonable opportunity period. It's not a single try, like, okay, it's a time period. So they get, if it is allowed for that particular population, they would get a single reasonable opportunity to say, please respond within 21 days or 14 days or 30 days, whatever the specific federal law says is allowable for that single opportunity period. But they have a certain amount of time to respond back with the documents. And if they don't, their case is generally closed. So it's not that they had, in many cases, they have not gained eligibility yet during that reasonable opportunity period. This bill describes sometimes that the benefits are beginning. That's not really the case for most groups. So until citizenship is verified, most people do not start on Medicaid unless they're in emergency services group or something like that.
Additional questions, committee? Comments? Seeing none. Thank you, gentlemen, for joining us. Any other government agencies? Seeing none, we'll open it up for public comment. If you plan on testifying, please come forward. We have 3 chairs here. Senate File 106. Good morning. You'd state your name or we will hear your take on the bill.
Good morning, Madam Chair, members of the committee, Kelsey Prestisator with the Wyoming Hospital Association. First, I want to thank President Beitman for working on this with this bill and addressing the concerns of our hospitals. I really do appreciate it. We just have a small number of amendments that essentially just do 4 things here. And I believe those are the amendments that you all have in front of you. Essentially, what these amendments do, and I'll just list the 4 things that they do, and then I'll go through it line by line. This amendment reduces the quarterly reporting requirement down to an annual requirement for our hospitals to reduce the administrative burden and cost of the reporting while still providing all of the data to all of you and the Department of Health. It also pushes the effective date for the reporting requirements just out a couple of months to allow our hospitals to get their online systems updated and paid for, and to train their staff on when to collect the data so that we don't violate any of our federal regulatory requirements like EMTALA, which requires that we not delay or deny treatment before providing emergency care. It also pushes all presumptive eligibility reporting out to the Department of Health instead of placing that burden on our hospitals. The reason that we propose that amendment is because the Department of Health, like they mentioned, is already collecting that data. That's something that's already being done. And when our hospital staff work with patients to verify their identity and their financial status, they conduct the presumptive eligibility application with the patient, and then they collect an identification card and they send that information off directly to the Department of Health. So all of that data and verification is already being done on that end. So it's basically just avoiding a duplication of efforts. The last thing that this amendment does is it ensures the data is de-identified to basically to soothe any HIPAA concerns that we have, especially with our smaller hospitals. Say that there's some kind of diagnosis that's pretty crazy. It'd be pretty easy to identify if there's, one case that gets reported to a Department of Health. So what this does is it ensures the data that our hospitals do report is de-identified, and then also requires the Department of Health to further aggregate that into one report from all hospitals before providing it out to you guys at the legislature. And it also limits the reporting from reporting on all individuals across the board, just to exclude additional reporting on U.S. citizens and only include that reporting will be done on individuals who are not U.S. citizens or not lawfully present. So still complies with the goal of this bill, which is to ensure that there's integrity in our Medicaid program and the individuals who are not eligible are not receiving benefits. So those are the four things that this amendment accomplishes. So I'll go through it one by one. Right here, the first kind of line in red just corrects Medicaid to Medicaid. It doesn't really do anything. But moving down into subsection 1 and I'm going to follow the engrossed bill here. Subsection 1 on page 14 subsection B, subsection I underneath that, beginning no later than April 1st, 2027. That's where it pushes out a couple months to allow us to update our online systems. And then beginning in subsection 2, beginning no later than April 1st, 2027. That also allows us additional time to update our systems and train our employees to let them know that care will not be impacted by these new requirements. In subsection 3, that pushes the first report date out to beginning with calendar year ending on December 31st, 2027, gives us additional time again to complete that training, update our systems, and then compile those first reports to get sent off to the Department of Health. Yep. And then moving down into here in subsection 3, the language that is amended says reports the total de-identified number of hospital admissions and emergency department visits within the previous calendar year instead of quarter, and further disaggregated based on whether the patient's representative indicated that they were not a citizen or not lawfully present. There is one additional amendment that we'd like to propose here in this language, again, just to remove any additional reporting on individuals who are verified to be United States citizens. And so I can either propose that amendment now or wait. Would you like me to propose it now?
Yeah, you can mention it. We'll
Okay.
consider it.
Okay, so in subsection 3, moving down where the amendment says whether the patient or patient's representative who indicated he or she was a citizen of the United States or lawfully present in the United States was not a citizen or not lawfully present or declined to answer. We'd like to propose that we strike was a citizen of the United States or lawfully present in the United States. And that essentially, again, would just ensure that we're collecting data specifically tied to individuals who are not lawfully present or not U.S. citizens. And then in the last amendment down in subsection 4 pushes out beginning in calendar year 2028 by April 1st for the Department of Health to take all of the data that our hospitals have collected throughout the year and given and turned over to them. It allows them that time to then compile the report, de-aggregate the data, and provide it over to you, the interim committee and the governor. And again, that section also adds that the data must be de-identified and disaggregated. And then that section does require that the patient data include whether the individual is a citizen or not. And the purpose of leaving it in this section and not the prior section is to take the requirement to report on U.S. citizens off of our hospitals, but maintain it in the Department of Health report. And the reason for that is that the Department of Health and our hospitals already collect hospital admission and discharge data. That's something that's already being done. And then at the very end of the report, it also includes that the report should include information based on hospital presumptive eligibility applications submitted to the Department of Health and lays out additional requirements on the department there.
Okay. Thanks for walking us through that amendment. Mr. Bully, do you have anything you want to add?
Thank you, Madam Chairman, committee members. Eric Bully with Wyoming Hospital Association. We worked very closely with the sponsor of the bill to come up with this. We feel like we've landed on a sweet spot. What I would like to mention though is that we are in favor of this bill mainly because we think that there shouldn't be any fraud either. And I think what we've heard is there's very little fraud that's been detected in our state. We've seen some a couple of examples of pretty large fraud in a couple areas, and they were dealt with. But what I would say is our hospitals are doing everything they can to make sure that they're staying in compliance. There is no fraud. And I think one thing that you should realize, this bill could have a little bit of an impact going the other way. So right now, there's currently under our existing Medicaid program, if an undocumented person comes into our hospital for emergency care, they're taken care of. There is a fund under the Medicaid fund that pays for that emergency care. And we're talking right now, I think the numbers are about 80 a year is all. When you consider how many hospitals there are and how many ER visits they may have. It also covers births for undocumented people as well. But I also think we're doing a bad job of tracking that. And I think a lot of that probably ends up on our uncompensated care line. And so I actually think this is going to be a good tool for our hospitals to track that uncompensated care. But I would also expect that with education, they may realize that they can probably bill for some of those emergency cases that right now they're just writing off. We appreciate the sponsor allowing us to push this out a little bit. There was some concern from our members that people may not seek care because they were worried about us collecting the data and finding out if they're citizens or not. And obviously we want to take care of people. That's the mission of our hospitals, just to make sure people stay healthy. And I think it's our mission and calling is what we're supposed to do. We think that there are safeguards put in place now for when we collect that data. When they come to the emergency room already, we care for them before we even start worrying about payment. But this is just a matter of checking a box on the intake form after the fact. When it comes to inpatient care and other things like that, we'll be collecting that information. But there's going to require some training to make sure that we internally don't get the cart before the horse. We don't start asking questions to make sure that we don't violate EMTALA accidentally. And we're always working on that. So we appreciate that. We also need to do some upgrades to our emergency health records, our EHRs. We found out as we became aware of this bill, we started querying our members. Some of them have some of the big EHR systems that it's a matter of flipping a switch and they can capture this data. Others have antiquated EHRs that may require some interfaces or programming that needs to be built. Again, unfunded mandate, similar to the bill that we passed through this committee last week that had to do with price transparency, but we're willing to do that. We also need to make sure our folks are trained. But with that, we're ready to stand this up. We're ready to do what we need to do to collect this data. And I think it'll be eye-opening probably as we look through this. I think even we are interested to see where this ends up as we calculate our uncompensated care, as we share that through the Department of Health with you on the overall bill. And again, we're grateful for the partnership and the collaboration that we had in working on this bill. And I'd stand for any questions.
Thank you. Committee, any questions of Mr. Boley? Okay, seeing none. Thank you both for joining us. Sir, please state your name and we'll hear your take on the bill.
Madam Chair, members of the Labor Committee, my name is Jeff Daugherty here today on behalf of FGA Action. I want to begin by thanking the sponsor, Madam Chair. He has been phenomenal at driving White House priorities, and he agreed, as he indicated, to do that at the last minute. So we sure appreciate him. I also appreciate the two individuals seated next to me, as well as the state staff who were willing to work with us on short notice to try to get this bill right for you. My apologies for not getting you this amendment before today, Madam Chair. But I do want to say on behalf of FGA Action that we love work. We think that work is a blessing at FGA, and we want to get as many people as we can back into the workforce. We think that gives you purpose it builds your self-esteem. So as indicated, this bill asks a few simple questions. Number one, are you dead? If you're dead, we don't think you should get welfare. If you are illegal, we don't think you should get welfare. If you refuse to work, we don't think you should get welfare. If you're registered in multiple states, we don't think you should get welfare. And so we think this bill does much to help address that. So Madam Chair, I'm trying to not repeat things that other speakers said, but I do think that this bill fosters self-sufficiency, it fosters opportunity. We think that we've come up with a reasonable implementation period that won't cause flat-footedness. I like that in our very small communities where literally the individual who has an amputation would be immediately available. And I like that we've now de-identified that so that there's better privacy in the bill as a result of our work with these people. Madam Chair, in light of the hour, I'm going to stop there and answer any questions.
Thank you. Committee, any questions of Mr. Daugherty? Okay, seeing none.
Thank you.
Thank you all for joining us this morning. Further public comment, please come forward. We've got 3 chairs. Good morning. If you'd state your name and we'll hear your take on the bill.
Good morning, Madam Chairman, Committee. I'm Tom Laycock with AARP Wyoming. We're a membership organization representing roughly 75,000 Wyomingites over the age of 50. Today, we're asking actually for an amendment to SF 106 that would direct the Wyoming Department of Family Services to allow family caregivers to be exempted from these from the work requirements on page 8, line 9 of the bill. I did send the amendment to you guys earlier. Ultimately, what this would do is if you look at page 8, line 7, the Department of Family Services shall not exercise the state's option to provide any exemption from work requirements under 7 USC. We're asking for an amendment because it's our fear that sending those who are taking care of loved ones with chronic issues or disabilities may actually doom some to institutions, such as nursing homes when they can be taken care of in the home by the caregiver at less cost to the state. We strongly urge you to explicitly exempt family caregivers using the federal definition listed in the One Big Beautiful Bill Act. We think that amendment could read, I'll put a little C under that on page 8, line 9. The Department of Family Services shall waive work requirements under 7 USC to exempt family caregivers using the definition in section 2 of the Raise Family Caregiver Act as cited in the One Big Beautiful Bill and consistent with congressional intent. The definition reads, quote, an adult family member or other individual who has significant relationship with and who provides a broad range of assistance to an individual with chronic or other health condition, disability, or functional limitation. Now, this isn't a new concept. The recently enacted One Big Beautiful Bill Act introduces work requirements for some Medicaid beneficiaries and exempts family caregivers. Providing care for an incapacitated person has also been previously a federal recognized exemption from SNAP work requirements. To be considered under that exemption, an individual does have to provide some form of documentation. Note from a doctor, you could also consider documents showing caregiver has been appointed as a representative to manage the loved one's finances, or even evidence of participation in a family caregiver support group. So as mentioned earlier, the One Big Beautiful Bill Act does exempt family caregivers. According to AARP analysis, the average family caregiver is already giving over 35 hours a week of professional caregiving at no cost. It's clear from talking to the bill sponsors and others associated with the bill that caregivers are not the ones the bill seeks to kick off the couch and send back to work. There are also financial incentives for the state to allow for this waiver for family caregivers. When an older adult reaches a Medicaid level of finance and a nursing home level of care, they can go into a nursing home or receive in-home care paid for by Wyoming Medicaid. In many cases, having a family caregiver in the home providing care is enough to keep that loved one at home and help to keep the person from spending more than $6,000 per person per month, which is the cost for Medicaid skilled nursing care. So asking these family caregivers to ask for 80 hours, asking these family caregivers for 80 hours in the workforce each month could mean less care at home and could result in higher long-term care costs to Wyoming. Once again, I'd ask for your support on this amendment. I'd like to thank you for your time and be happy to stand for any questions.
Thank you. Committee, any questions of Mr. Laycock?
Okay,
Seeing
thank you.
none, we'll take your amendment into consideration when we work the bill. Thank you. Any further public comment? Okay, seeing none. Anybody online? Okay. Okay. Ms. Lo, can you
Hello?
hear us? Yes,
Yes,
please
I
speak.
can now. I
Well-
can now, thank you. Good morning, Madam Chairwoman and Committee. My name is Jan Loftus. I'm from Johnson County, and I speak today representing Republican Women of Sheridan County Legislative Action Committee. Thank you for taking this time to listen to our comments. The Legislative Action Committee currently opposes this bill, but would support this important and timely topic if the bill was strengthened as we suggest. Since we have all heard the news of abuses in other states, we strongly suggest you take this up as an interim topic unless you have time to amend it adequately. Hillsdale College publication Imprimis, January 2026, said Minnesota, where the amount of money bilked from American taxpayers could prove to be as high as $9 billion. But the scandal is spreading to other states as well. The changes to the bill, which LAC requests, are contained in our action alert email you should have received last evening. I wish to credit American Legislative Exchange Council, ALEC, for most of the ideas contained in their welfare reform model legislation. The Senate Committee of the Whole amendment weakened the bill in many ways. We request that you please remove the extension of eligibility verification periods at a minimum. If the original bill was too frequent, consider something between the original and recertification. Since Social Security numbers are available to legal aliens, this needs to be an included verification of legal status. You might add the words as per the ALEC model legislation that says the department shall notify applicants and recipients of the requirement of providing a Social Security number at the time of application for assistance and is needed thereafter and pursuant to the provisions of this act. There are many income verification methods very good in the bill, about 10 to 12, but additionally, we request you include 5 more. And that would be 1, unearned income maintained by the IRS. Wyoming income, number 2, Wyoming income and unemployment insurance benefit payment information. 3, veterans benefits and veterans medical database by the VA. 4, Wyoming daycare subsidies by DFS. And 5, the low income energy assistance program reporting utility expenses database maintained by the state. In the bill, medical care facilities are asked to ask patients on the honor system whether one is a legal alien, illegal alien, or citizen. Rather, a card should be issued by the Department of Health to those determined eligible as legal aliens. And as previous speakers have said, emergency care is already provided for everyone. Page 17, line 18 of the engrossed version, we suggest you delete to the extent practicable those words. Otherwise, the sources of income verification become optional. We suggest you specify that the Departments of Health and Family Services notify the sheriff and the Wyoming Office of Homeland Security, in addition to the U.S. Department of Homeland Security on page 11 of the engrossed version. To bring the ALEC model legislation suggests bringing in the counties stating within 1 year of the effective date of this act, county commission boards shall establish procedures to identify, investigate, and resolve potential cases of fraud, misrepresentation, or inadequate documentation prior to determining an applicant's eligibility for assistance. Each county board shall submit to the department a plan describing its anti-fraud procedures. We'd suggest legislature as well, that their plan goes there. The plan must be systematic and ensure that every case is reviewed. Further, the review must include utilization of the income eligibility verification system established by this act. We would prefer the implementation date to verify Medicaid with other states change from October 2029 to 2027 on page 4. In closing, unless you are able to make these changes to make our state as fraud-proof as possible, we'd suggest you table the bill and make this an interim topic. Even if you pass the legislation, we would suggest that you take this up as an interim topic due to the importance we've seen throughout the country recently. Thank you.
Thank you. Committee, any questions of Ms. Loftus? Okay, seeing none. Thank you, ma'am, for joining us. And we do have your email with the recommendations.
Thank you.
Okay, any last call for public comment? If you'd state your name, we'll hear your take on the bill.
Good morning, Madam Chair. My name is Micah Richardson. I'm with the Wyoming Women's Foundation at the Wyoming Community Foundation. I had not planned to speak, but I just wanted to bring up a couple of points. One is that our error rate, so keeping in mind the error rate and the fraud rate are completely different, right? Error rate might be late payments going out, something like that. Our error rate for SNAP is currently 3.72 with a fraud rate of less than 1%. On the Medicaid side, our error rate is 1.6. I do not know the fraud rate on that side. So things are already incredibly low. I would just caution that including more updates would likely cause more work for both of these and increase that error rate. And so I think the things that we have in place already that align with what's already at the federal level is great. It seems to be working incredibly well based on these numbers. And so I just want to put a little caution out there and to keep in mind that those are two very different things, error rate and fraud rate. That's it. I stand for any questions.
Thank you. Committee, any questions? Okay, seeing none, thank you. All right, with that, I will come on up. Yeah. Mr. Springer.
Chairman Rodriguez Williams, just on the previous testimony from Jan Loftus, I'm sorry to mention that person's name. Some of the items mentioned are just not legally possible. So the system that's being built to verify that has that 2029 date in the Big Beautiful Bill, that system does not currently exist. So that system is being built by the federal government by 2029. We participate with an existing system, which we are able to verify quarterly. And we are also doing data matches with the federal government. But the monthly system does not currently exist. And the federal law does not require that the federal government to build that system until 2029. So that's just a minor detail. I mean, we will comply to the best of our ability with any dates that are placed in a bill. But we'll have to just report back if the system that we're being verified with does not exist. The Veterans Administration has a system called DEAR. That system has been broken. And we have not been able to verify with that system for many, many years. We cannot verify veterans benefits and TPL, third-party liability with the federal government. Currently, they've been working to fix that system for a very long time. It's always around the corner. So there's a number of those minor details. For certain items of verification in the bill as well, we verify certain things like identity. We verify a single time because we don't have to re-verify someone's identity monthly because we've already confirmed the social security number exists, valid, the name and all those things match. So we're not re-verifying, or we're actually not allowed to do certain things to re-verify things that are not changing. So those are just minor details, but I appreciate the opportunity to step back up here.
Thank you. Any questions, Mr. Springer? Representative Yin.
Madam Chairman, could we just bring Director Schmidt back real quick to ask about AARP's amendment suggestion?
Absolutely. Representative Yin, go ahead.
Madam Chairman, Director, Mr. Laycock's suggestion with a new subsection C feels a little clunky. I wonder if we could make that simpler and if you had any thoughts on his suggestion at all or whether it's needed.
Director Schmidt.
If you remember
So
it.
we're on the engrossed version.
Page 8,
Do you have?
lines 7 through
that one?
9.
Yeah.
Madam Chairwoman, Representative Yin, we don't have any concerns necessarily about any changes to the statute to be able to comply with what AARP is requesting. We do think we already have some flexibility to do that under the current law. I think they're looking at a little bit more of a technical policy discussion, which is, under your purview, but we don't have any concerns in terms of being able to structure the program to allow for that waiver.
Additional questions of the director? Okay, thank you, ma'am. All right, I'm going to close public comment on Senate File 106. Committee, what is your pleasure?
Move the bill.
Bill's been moved by Representative Wasserberger. Second by Representative Thayer. All right, let's work the bill and have some discussions. Representative Thayer.
Thank you. I'd like to move the amendment that we have on 42-12-106 that was given to us. I just would like a clarification in section B, number 3 on line 7 that Kelsey, the Wyoming Hospital Association, if I just would like to have it read back so I'm 100% clear on what that addition or change was.
Yep, Representative Thayer. So the suggestion, if I remember correctly, is to, under the red line there, remove, strike was a citizen of the United States or lawfully present in the United States, is what my notes say. And I see some heads nodding. So under section 3, striking was a citizen of the United States or lawfully present in the United States. And again, that's duplicated on the next page, but the recommendation was to keep it on the next page, but to strike it on this side. So
Thank
is that your amendment?
Yes, thank you.
So the motion is to adopt the handout amendment, but amend the amendment with the strike.
Yes, thank you, Madam Chair.
Is there a second? Second by Representative Wasserberger. Discussion on the amendment. Okay, Mr. Caldwell, I just want to confirm you have that.
Yes, ma'am.
Okay, question being called by a voice vote and a show of hands. All those in favor of Representative Thayer's amendment, state aye. Aye. All opposed? Okay, that amendment has passed. Additional amendments, additional discussion.
Madam Chair.
Representative Yin.
Madam Chairman, so I will make the amendment on page 8 after the period, before the period on line 9, add except for family caregivers as defined in section 2 of the Raise Family Caregivers Act. and maybe we get LSO's help to do that properly.
Okay. Pause for a second. I need to pull up that amendment. Is it the exact language as what was emailed?
No, it's not.
Okay. All right. So this is different, Mr. Caldwell. Go ahead and repeat it, Representative Yin, please.
Madam Chairman, it would be to insert before the period, except for family caregivers as defined in section 2 of the Raise Family Caregivers Act.
Okay, Mr. Caldwell, do you have that?
Yes.
Okay. Is there a second? Second by Representative Gugemás. Discussion on the amendment. Representative Yin?
Madam Chairman, thanks. Yeah, I just suggested this language because it's a little simpler than adding a new subsection. It still gives, frankly, the authority to the department to decide if they want to waive that work requirement rather than the shall and Mr. Laycock's amendment. But I think it's still a good policy choice to incentivize caregivers under that act.
Okay, any further discussion on the amendment? Seeing none, question being called by a voice vote and a show of hands. All those in favor of Representative Yin's amendment, please state aye. Aye. All opposed? Okay, that amendment has passed. Further amendments? Okay. Any further discussion on the bill? All right, committee, I know that there was quite a few that came in from LAC. We heard public testimony on, and those are in an email that you should have received too, so it's a little more lengthy. I don't think that there are any other recommendations that came before us in public testimony. So further discussion on the bill. Question being called. All those in favor, roll call vote, Mr. Caldwell on Senate File 106.
This is a roll call vote for Senate File 106 as amended. Representative Clouston.
Aye.
Representative Guggenmoss.
Aye.
Representative Heft.
Aye.
Representative McCann.
Aye.
Representative Ottman. Oh, my apologies. Representative Ottman left an absentee vote of aye. Representative Thayer.
Aye.
Representative Wasserberger.
Aye.
Representative Yen.
Aye.
Chairman Rodriguez Williams. Madam Chairman, that is 9 ayes.
Okay, Senate File 106 has passed. We have one last bill on the agenda, which is Senate File 122, Medical Necessity Standard Timeline Amendments. I don't see the bill sponsor here, who is Senator Dockstader. And I don't know that we have a lot of time to go through the bill, so Representative Boley, not Representative Boley, Mr. Boley, you have something to say?
Madam Chairman, committee members, Eric Boley, Hospital Association. I just texted Senator Dockstader. I'm not sure if he'll make it across, but I will let you know that we had a conversation about this during the last week. We're not the sponsor of the bill, but one of our members did bring it forward, and Senator Dockstader has agreed to have the bill laid back indefinitely if we could do that. We don't actually think that the bill accomplishes what our hospital thought it would, and we have presented an interim topic that would address that.
Thank you for the informal information. Committee, is there a motion?
Make a motion to table the bill then?
Okay. There's been a motion to table Senate File 122 by Representative Wasserberger and seconded by Representative Dugamoss. Any discussion? Okay, seeing none. Is that a roll call vote?
Yeah.
It's a voice vote. Okay, thank you. All those in favor of Representative Wasserberger's motion to table the bill by a show of hands and a voice vote, please state aye.
Aye.
All opposed? Okay, that bill has been tabled. We have no further business on the agenda this morning. Committee, thank you for all of your hard work this morning, and we are adjourned.